So I hope I'm still friends with all the speakers after that, because being the time manager is always difficult, but it's my great pleasure to introduce Gisèle Sebag, who is going to share with us the impact of this model on urban health. And Gisèle is the executive director of the International Society for Urban Health. Thank you.
Thank you so much. I'll try to be brief because there's so much to say and there's so many wonderful speakers. But first, thanks so much to Carlos, Catherine, and the many partners for inviting me to talk about the scientific field of urban proximities and how it really promotes public health. So as Catherine said, I'm Gisèle Sebag, architect, urban planner, and public health practitioner by background. I like to think of myself as dedicated to transforming cities by design. And I also serve as the first ever dedicated executive director of the International Society for Urban Health. We've been working for over 2 decades at the forefront of defining and advancing the field of urban health and recognizing that cities function as complex, interconnected systems. We really do work across all the traditional disciplines and sectors to ensure that urban design, policy, and infrastructure all come together to foster healthier, more equitable communities. And one of our greatest priorities today, which is why I think Catherine invited us, is bridging the gap between research and real-world action and impact. So we're really translating the decades of evidence that we now have into actionable strategies that do improve neighborhoods and cities for everyone, regardless of race, background, age, income, or even geography. So today, what if I told you that zip code, or where you live, your neighborhood, actually has more influence on your health than your genetic code? More impact than healthcare you receive or the doctors that you visit. It's really the design of neighborhoods and the places that we spend time that determines how we move and the air we breathe, or our stress levels, our social connections, and even how long we live. And proximity is really this common ingredient, actually, if we think about it, that lets all those parts work together for health. So it's not only distance, as we know, but access, quality, choice, time saved, and equity. And that means that cities, when they are designed to really support health, they can be one of the most powerful tools that we have to improve public health and well-being. But too often we fail to recognize this incredible potential. So very quickly, what determines our health outcomes? So really, I think of these things as 3 main categories. And your first one is genetics, and these are the things that we cannot change. We're born with them, we're stuck with them. But the second is your environment, and I think of your natural, your built, and your social environment, and then your behavior, so the choices that we make every day about what to eat, if we're going to exercise, whether we smoke, take drugs, or drink alcohol. And so I have very good news here, which is that the scientists, we have figured out that the leading drivers of death and disability around the world, those are non-communicable diseases. They are largely determined actually by a combination of your environment and your behavior. And why is that good news? Because your behavior and your environment are actually changeable factors. And so research keeps telling us that really it's only about 10% of your health outcomes that are determined by genetics alone. And so I like to think of this very optimistically to mean that perhaps that means that 90% or all these other areas are actually linked to changeable place-based factors that we have the ability to really change to support our health. Because if you think about it, even behavior is actually highly influenced by your environment, because how could you possibly choose to get exercise? Let's say, how could you walk? How could you bike? How could you go get exercise if you don't have a sidewalk or a safe cycling lane to do so? And on the other hand, if there are safe sidewalks and bike lanes, people can move around, reducing chronic diseases. So we'll talk about all of those things. And so one of the starkest examples actually of how place impacts health is when we look at life expectancy maps. This is very small. This is New York City. This shows life expectancy across a neighborhood. Every single city in the world has a map just like this. And in cities around the world, life expectancy can differ by 20 or 30 years between neighborhoods that are just a few kilometers apart. And it's actually the number 1 predictor of life expectancy is where you live. So what neighborhood you're in when you're born, your zip code, your neighborhood. And that means that babies that are born at the exact same time in the exact same cities, but a few kilometers apart in different neighborhood environments, have drastically different lifespans. So that's not biology, that's actually design, if you think about it. And of course, we know that walkable, mixed-use neighborhoods with proximity and access to schools and parks and transit lead to longer lives, and car-dominated, segregated neighborhoods lead to shorter ones. But there's also an economic cost to this. So, chronic diseases related to poor urban planning in the United States alone, so that's only one country, costs $3.7 trillion per year in only healthcare expenses. So not even, productivity or the other pieces of that. But cities can either help us live longer or they can cut our lives short. This is a choice, a design choice. Okay, so I'm gonna go quickly through proximity, why proximity matters. And I see that the formatting has gotten mixed up when we changed the format of the presentation, so hopefully you can figure it out. Okay, so why proximity matters. Incorporating physical activity into our everyday lives is one of the best ways we can actually improve multiple aspects of health through design. But insufficient physical activity or sedentary behavior is one of the largest killers worldwide, and physical activity is just so important to reducing the burden of chronic disease. You can see here in countless neighborhoods around the world, even in Europe, neighborhoods that are designed for cars are not for people, and how difficult it is and how polluted and dangerous it is to get physical activity if you don't have sidewalks, for example, as opposed to the human-scaled blocks, the connected street, the safe crossings, and a mix of real destinations that turn errands into health. We really shouldn't have to drive to move, especially when you can walk, run, or cycle or play as part of your everyday life. In a city of proximity, movement is actually a side effect of living well. Walking to school. Kids tell the truth about design in many ways. And so distance and danger actually keep children from walking to school. And if we put schools within walking distance or add safe routes, you can lock in healthy habits for an entire lifetime. You can get cleaner air. And it's not just physical activity or cleaner air. It's also creating everyday social ties. So that actually helps with social cohesion over your lifetime. But the stats make the case when we walk more, or cities that are walkable, people get 30% more daily physical activity, which it really reduces the risk of all those NCD factors. But in car-dependent cities, we know the opposite is true. We have higher obesity rates, higher stress, higher anxiety, and then again, there's a huge economic impact, which I won't go into for time. So food proximity really matters. Food deserts, but perhaps even worse, food swamps aren't just nutrition problems. I really think of them as access problems. Mixed use in a wide variety of destinations and markets and community food spaces actually lead to better diets and more social life in the same trip. Okay, and then road safety. So here's actually a typical person living and working in a car-dependent city, crossing a busy highway to reach the bus stop. And it's, there's millions of people just like this person who die every single day just because, there's a prioritization around the world of the very small minority of people who drive over those that are too young, too old, or have a disability, or simply can't afford to reach school or work or everyday necessities like the pharmacy or the grocery store. So not only is it inequitable, but it's really terrible for health. 1.3 million people die in road accidents worldwide every single year. And it is the leading the leading cause of death for children and in young adults aged 5 to 29 years globally. And this is completely preventable. It also costs a huge amount of money. I'll go through this one quickly because probably many of you know this story, but everybody thinks of Amsterdam today as a biking city. But in fact, until the 1970s, it was extremely car-oriented, and there was actually a movement to stop children that were being killed unnecessarily by cars. And so what I like to say is that if Amsterdam can do it, any city can do it. Air pollution is another reason that proximity matters. We could save so many deaths if we actually got people out of cars and walking, biking, and in close proximity with one another. Same thing with nature exposure. Huge benefits for our health if we did this, and we could actually prevent a huge number of lives by adding green space. Again, I think I'm short on time here, so I'm going to just run through these. Many of you might know the projects in Barcelona that I'm showing here. There's an amazing green corridors project. Same thing. This formatting is messed up. I did not put green corridors, I promise you. But anyway, it's an amazing green corridors project. It's restored green space. Barcelona has a real problem with green space, and it's really restored green space for so many people. And it's beautiful, and it's also made a huge health impact. We also have the Superblocks project, or the Super EAS project, which really has reclaimed public space from the car, brought people together, have people and kids play. It's an amazing project, and we know that it actually saves lives in so many different ways. It's really all about proximity. Here we can look at some of the mental health impacts of implementing the Green Corridors project across the city of Barcelona, reduced antidepressant use, medication use, and really improved overall mental health in many, many ways. It is documented, it is science, I'm not just making it up. And then social isolation and loneliness are huge issues today, and I really think of it as a proximity problem. It's as dangerous, we're finding out more and more how dangerous it really is. It's as dangerous as smoking up to 15 cigarettes a day. And young people are actually the ones that are suffering the most. Why are we designing places that separate us, make us unhappy, and make us alone? We used to design places that brought us together. I'm going to skip this, but this is an example in Bryant Park, New York. And the lesson here is that, as I know many of you know, and I know Carlos and Katrin and all the partners talk about so much, proximity alone is not enough. We can have proximity, but we don't have vitality, and that's the example of Bryant Park. We had great proximity, but nothing to do. And we can really activate the space, create great destinations, and I think, as Carlos might say, have this idea of polyfunctionality, or what we in placemaking call the power of 10, to create and activate places. That's what really transformed Bryant Park into what it is today. So I'll just finish with this quote from my great friend and mentor, Fred Kent, and I think Jan Gehl really echoed this yesterday. It's so obvious, but somehow we don't think about it and we don't implement it every day. That if we plan cities for cars and traffic, we're going to get cars and traffic. And if we want to plan cities for people and places, and I would say for health and great health, we're going to get those things, but we have to intentionally think about that as we create proximity, as we create great cities. How do we actually support health? And basically, I think of proximity as the foundation of a great, healthy, sustainable, equitable city, but you need other things as well, but you really can't do it without proximity. So thank you.